Hello, this is Trends. I am Bumi Obano. And as always, I have Moses right here with me. He's the online producer, Moses Omogena. How are you doing, Moses?
Digital producer.
Well, online, digital.
I have to defend you. What's up, Bumi?
I'm good.
Yeah, a lot has been trending as usual. Now, we have three very important trending hashtags on Twitter and social media platforms. Now, I take them one after the other. The very first trending is hashtag Save Yakubu Yusuf, or hashtag Save Yakubu Yusuf. Yeah. Now, this hashtag was created in solidarity for the fight against cancer for a young man, Yakubu Adetunji Yusuf, a 30-year-old psychology student at University of Lagos. Now, Yusuf was diagnosed with cancer December 2013. Cancer, nasopharynx cancer, or cancer of the throat, if you like.
Wow, now I understand.
Yeah, cancer of the throat. Now, according to medical reports, the cancer is curable, but in India, at the Apollo Cancer Research Center, to be specific.
It's curable?
Yes, it is. Good news, yeah, but he needs 7 million naira for that treatment. Hence, the whole awareness campaign, solidarity, the movement, and the fundraising attempt to raise that money, which has been quite slow. It's been quite slow, but there's a lot of hope, and action on that to raise that money, because
and I believe a lot of people have been tweeting and talking about
exactly. So we want to use this medium to appeal to everyone watching, to stand in and to do what they can to save Yakubu. He wants to live, and I believe he deserves to live. So now, next is hashtag Feed the Child. Feed the Child was something that came up a few days back that has sparked controversy in South Africa, and a commercial ad that was said to be racist and in bad taste. Maybe if we can have a look at the video now.
This is the controversial ad. The advert, which has since been removed from YouTube, shows the child being fed snacks by a white woman. But the commercial aid here in South Africa has drawn widespread condemnation from all quarters. Feed a Child released this video earlier this week. In it, its CEO defends what many South Africans have described as an insulting television commercial.
I'm Elsa Rotenbach, founder of Feed a Child, and I have a deep-rooted passion for all children of South Africa. Like a child, I don't see color. Like a child, I don't see race or politics. The only thing that is important to me is to make a difference in a child's life and to make sure that that child is fed on a daily basis.
The ad has attracted worldwide attention, and here in South Africa, many have described the ad as racist, with one Twitter user even going as far as saying that the ad best describes NGOs' perspectives on Africa.
I can remember seeing that advert and thinking, what's the idea
before we say much, I would like to say that Feed the Child organization, they meant well. In agreeing that the whole idea was to create awareness against stark and widespread malnutrition for children in South Africa. But like you said earlier, it was a good intention that was badly interpreted.
I think that's what a lot of people are saying on social media.
Exactly. When I saw that video, you see a white woman, petting the child, and feeding the child crumbs from the table and stuff like that. I'm sorry to say, but personally, when I saw that video, the impression you will get at first is contempt and disrespect for black children when you see that video initially. But there's been controversy on the other hand that, that's actually the hard truth that, black children are actually suffering from this, from malnutrition. Exactly. But on the other hand, it's an ad. It's not a documentary. So if I see an ad and I don't get the message on the first watch, then that ad has not really done what it's supposed to do. So it's one thing treating a child as a pet or a pet as a child, and it's another treating a child as a pet. When you treat a child as a pet, it becomes disrespectful, which is the argument in South Africa that raises awareness. And lastly is hashtag Brazil versus Germany. Oh my
I could
God.
just picture when
You
you
know,
said Brazil.
the whole world was actually rooting, wasn't expecting that, how it turned out, 7-1 against Brazil. Now we have a video, we saw that on the screen, where you see, the Germans squashing the head of a Brazilian.
I actually watched that match, and it got to a point where I had to, leave. I couldn't stand it. I'm not Brazilian, but I felt
because
felt it.
when you see the #1 or like the mecca of football being humiliated like that in history, you cannot but wonder what's going on. So
it was a good match, I would say. It was really interesting. And remember that you can always be a part of the conversation by sharing your views with us via Twitter at TVC Trends. Comment on our Facebook page, facebook.com/TVC Trends, and send your pictures and video comments to thetrends@tvcnews.tv. We always want to hear from you. Now, moving on. The Ebola virus is one of the deadliest diseases ravaging the West African sub-region in the recent time. The epidemic, which is spread by exposure to infected bodily fluids and other secretions, is thought to have begun in Guinea in March, before spreading to Liberia and Sierra Leone. We have more than 759 cases across 60 sites since the first ones were confirmed, which means that almost 50 known cases per week and a 20% increase in cases since the 23rd of June. Okay, now let's break this down. Almost 500 people have died from the disease, speculated to have spread across international borders. So you can understand the fear that must be going across the continent and even the world. The UN and other humanitarian organizations struggle to contain their deadliest ever outbreak. Now the question on everyone's lips is, are we next? I hope not. But today on the program, we examine the measures being taken to curtail the spread of the virus. But first, have a look at this.
After 2 days assessment and discussion on critical aspects related to the Ebola outbreak, participants recommended that governments mobilize relevant public sectors, communities, religious and political leaders to help improve awareness, psychosocial support and understanding of the Ebola situation by communities. Countries in the region will strengthen surveillance, case finding, reporting and contact tracing, and share information on the disease with the World Health Organization. It was further recommended that countries contribute to the African Health Emergency Fund to support response to outbreaks and other public health emergencies.
The resources that are required for us to accelerate the efforts towards stopping the current epidemic on Ebola virus. We have estimations in terms of the human resources that are required. I referred to this aspect. We have also estimations on the cost for the different components that have been agreed within the context of a sub-regional strategy of response. And we estimate within WHO that an amount of $10 million would be needed immediately to address the needs for the next 6 months.
The closure of borders to limit cross-border spread for now is ruled out.
We have received instructions from WHO that we should still keep our borders open, So I think that what we need is to strengthen surveillance at our various borders to ensure that people moving in and out of the countries are really examined.
As of 3rd July, 66 Ebola-related deaths had been recorded in Liberia. The country's deputy health minister says the outbreak took the country by surprise.
Sure enough, when we went into our surveillance, we realized that there were cases that have passed through our health facilities at the border that have died in our country, that was buried in our country, and people were already getting sick. So that was our first outbreak, which we were able to track down quickly, and then we were able to address it, so it did not continue for about 60 days. And then the outbreak in Sierra Leone, then we started having cases. Now it's becoming serious.
Between March and June, a total of 750 cases and 455 deaths attributed to Ebola have been reported in Guinea, Liberia, and Sierra Leone. According to the WHO, the outbreak in the region is characterized by an intense community transmission, emergence of community resistance, a high number of affected healthcare workers, and a wide geographical distribution that includes major urban areas such as Conakry, remote rural areas, and cross-border areas.
Joining us to discuss this and do justice to it, we have Peter Ogunubi. He's a doctor based in Nigeria. He's also the coordinator of Real Visionaries Initiative. And via Skype, we have Dr. Uni Krishnan. He's the head of Disaster Response and Preparedness Plan. Thank you both for being a part of the program. You're all welcome. So the online community, for one, has been very interested in this particular topic, and a lot of questions and comments where, you know, on our Twitter pages and Facebook pages. It was pretty interesting, and Moses is going to start with a question on Twitter, I believe.
Yes, I shall.
You've been telling me all about it. Let's hear it.
Now, yep, our very first comment comes from Ola Fomi, and she says, what are governments of these countries doing to complement the efforts of these humanitarian organizations? I mean, yeah, we know that there's a whole lot of, organizations, working, hand in hand with other organizations to curtail the outbreak. But the government seems to be aloof of these operations. How can we integrate them into this?
Well, if we had this interview 2 weeks ago, probably my response would have been different. But remembering that last week, the health ministers of about 11 countries in West Africa, they met just last week. And the summary of that, their summit, is that they've come together and they've realized that this is a potential danger. And the last submission was that they're going to create a regional headquarter, a sub-regional headquarter in Guinea, where they're going to put resources, surveillance, statistics, and every other modality together in place. And we believe that is a very good step in the right direction. So we may not be able to say clearly that government is aloof. We believe that, for example, Nigerian government, they are waking up, and 11 other countries in the West African region, they are coming together, and we believe they are working.
All right. If we have
yes, we have Uni.
Uni on Skype. He may want to respond to that.
All right. Dr. Uni, I still want to address this question to you. Now, with the presence of aid workers in these countries, the virus ought to have been contained by now. So what exactly are organizations such as yours, Doctors Without Borders, and other agencies doing about this?
Okay, there are different pieces of work involved in this. To begin with, strengthening the public health information campaign. That is very key for prevention and stopping further spread. That's one area where Plan International is actively involved, which includes activities such as getting information out through the radio, TV, and leaflets and pamphlets and so on, and including text messages. The second issue is about taking care of infected and possibly suspected cases. Please remember, some people will die, not necessarily from Ebola, but some suspected cases will die from cholera and dehydration, which if sufficient support and care and treatment can be given at the appropriate time, we can save those lives. That's exactly what organizations such as Doctors Without Borders is doing. It's a very credible and a fantastic piece of work which they are actually doing on the ground right now. And without that support, we are talking about more and more deaths in such places. So that's the second issue. The third one is strengthening government's ongoing efforts to both contain the spread as well as treat or take care of suspected cases. And agencies like Plan International is providing some infrastructure support and also material support in the form of medical equipments and other materials. Please remember, we are talking about 3 countries where the public health systems are extremely weak and they have very limited resources. It is high time the international community starts stepping in a big way to provide support to the governments as well as other agencies who are on the ground really
All
struggling
right.
to cope with increasing caseload.
Okay, thank you very much. And Dr. Ogunubi, I want to know this. You know, we can get lost in terminologies and what this is and forget that there are people out there that probably know very little
About the
despite
disease.
all the news reports that we keep hearing. So briefly and as simple as possible, what do people need to know about this disease?
Ebola virus.
And yeah, the virus.
Well, in a layman term, Ebola is a virus. A virus is an organism or is an agent that can attack human being
Okay,
and can cause disease.
that's very simple.
We have two other areas. We have fungi that can cause disease, then we have bacteria. When you buy your regular antibiotics for the bacteria. Antifungi, all the creams you buy, they are for the fungi.
Okay, so now
But the
particularly,
virus, it is an antiviral, which we do not have for now.
what makes it so deadly?
Now, the way virus works is that this virus goes inside the body and then it replicates itself inside the body, begin to multiply and then damage internal organs. And what makes it deadly is because you do not have a drug. If I have a bacterial infection, I can use antibacterial and it will go after a few days. If I have fungal infection, I can use antifungal, it will go. But with viral infections such as Ebola, there is no known vaccine for now, no medication, and the symptoms mimic, and that's another thing that makes it dangerous.
A whole lot of
It
other
mimics things.
diseases.
For example, patient complains of headache, diarrhea, it can be
It could be malaria, it could be typhoid.
Then they start vomiting. You'll be thinking of typhoid. Then they have fever. Still, you'll be thinking of typhoid. Before you know it, they have joint pains. You still like malaria. And then, before they know it, they start bleeding. That's when it's getting more serious. And organ failure. They stop making urine, and before you know it,
And
death.
all this happened within a very short
Within a
period
very short
of time.
2 to 21 days is the incubation period. Once the symptoms come, you don't get the person to the hospital and start rehydrating, give blood if necessary, try to prevent death.
Despite the fact that there's no cure, it shouldn't be too difficult to contain because you need close contact, right? So if you isolate people that have been infected with this disease, then chances are they would not be a harm or a threat rather to other people. So why is this still so difficult? I know Dr. Uni has talked about it briefly, but from your perspective, why is this still so difficult?
You see, when you talk about isolating people, don't let us think people are in this room that you isolate. For example, Guinea is a country. How many people do you want to? With your level of surveillance and everything, just imagine, God forbid, this thing happens in Nigeria. There are so many people in rural area that will come to this Lagos, for example, they go to Abuja, they go back to the village. How many contact tracing do you want to do? So it is even more difficult that you have to curtail the people. Many people will not report. Some will die in the local villages that people will not get to know. Some will go to marketplaces. You can just see migration, the way people move from one place to another, cross-border boundary, everything. So that is why it is difficult. Any agent that you cannot pin down and treat or control, it becomes more difficult. If you now have to be quarantining and be bringing people that are affected.
We'll go on a short break, and when we come back, we'll continue talking about this deadly virus called Ebola. Welcome back. And joining us, already I've introduced Dr. Peter Ogunubi and Dr. Uni Krishnan. Now we also have Dr. Bart Jensen. He is the Director of Operations for Doctors Without Borders, and he has joined us. So welcome, Dr. Bart. Dr. Ogunubi, I know you have talked about it briefly, but one thing I want to know is the response to the locals. I know it's most important because at the end of the day, they are the ones on ground and they are the most affected against this Ebola virus. How else do you go about educating people who most likely are very opposed to Western medicine or, the government and all of that? How do you go about educating these people that we're here to help and not to hurt you?
Well, I believe, first of all, collaboration with authorities. By authorities, religious authorities, be it church, be it mosque, traditional, wherever institution, market women, they have their leaders. You first of all have to go through this.
The grassroots.
You must go through the grassroots.
Yep.
Not only in Guinea, even in other countries that this thing has not spread to. People must begin to use jingles, must begin to go to marketplace, even in Nigeria, in Ghana, everywhere. Begin to sensitize people that, hey, there is a particular, not to create panic or anything, but the fact remains that when people are already aware of something, it will help them to prevent it. Prevention, they say, will prevent certain things like this.
Okay, so I believe we have Dr. Bott with us. I want to know what Doctor Without Borders has done so far.
Okay, well, we have set up several treatment units in the entire area. First in Guinea and then spreading also across the border from Gekedu into Sierra Leone and Liberia, and then in a later stage also in Conakry. So now we have about 6 full running treatment centers in the area, specifically in the most affected areas. But for us, this epidemic, as we've worked in many other Ebola epidemics before, is the first time where we do not at all have the capacity to have enough of these treatment centers, plus the whole work around to do contact tracing and to communicate the correct messages to the surrounding communities. So that's where we are now stuck.
We have reports that in these hot regions, you know, some Africans still don't believe in the existence of the virus. So how do you manage that? How do you get to tackle that with your work?
Yeah, well, the main issue now is to tackle the large spread of the disease. And on the other side, we still have a big uphill struggle to get the right messages into the community. There are still quite a lot of the villages where the beliefs continue to work against control of the epidemic. And we really, together with local communities, need to manage to turn around the understanding and the behavior in the communities to allow better control.
Okay, well, reports say that, you know, 1,500 victims are out there who do not know that they are carriers of this particular virus or disease, rather. How do we know that? How do you prove that?
Well, the main thing which we have to do is to have rapidly all the people tested that have that are suspected. We have a few very good labs in the area, and that it's very important to have with the clinics we have in the area also a continued presence of good laboratories in the region, so we can quickly separate people that are sick but in the end do not have the virus, and people that need to be continually isolated and put in the special treatment units so we can give the best care to them.
Thank you very much.
Now, of tweets, I mean, they're coming, and we have from Ben Morgan, and says, hashtag Ebola cannot be cured, but West Africa's epidemic may have been preventable. And CCTV Africa says health officials report more casualties from the West Africa hashtag Ebola outbreak. And Double EFP says, so there was a regional hashtag Ebola outbreak meeting and Nigeria's Minister of Health was nowhere near the venue. Do you want to react to that?
That's not true. Nigerian minister was actually there.
Okay.
So I can tell you that he was there. And also, of course, don't forget that we will still not fail to say Nigeria were a giant of Africa when things of such, largest GDP, economic growth, and everything. And to fight Ebola, you will need money. Donor agencies may do their best, but every country must pull resources together, and that's what they agreed to do. And that's why a sub-regional center is being created in Guinea. So Nigeria is well represented. But one thing I want to also to say is the fight against Ebola, we must not wait. What Guinea government did, what Sierra Leone government did, what Liberian government did was that they waited for the outbreak before they started doing something. And that is why I'm hoping that the You can imagine what? Air Mauritania, for example, has refused conveying people moving from Dakar to Conakry. Senegal has closed its border, which is affecting people. Now they are telling people there must not be anything like eating bats, eating antelope, or they have cancelled every form of bushmeat. They clamp down on supermarkets that sell bushmeat. You just have to be
vigilant
and be aggressive. Don't forget that Pakistan, Afghanistan, Nigeria, we are still talking of polio virus when every other person have eliminated it.
It's time for us to relax and gather our thoughts, and we'll be right back. Welcome back. Now it's time to talk a bit about funding. Just last week, Dr. Louis Sambo, he is the World Health Organization Regional Director for Africa, says that the organization would need $10 million for the next 6 months to fund these organizations and get the job done. Dr. Bart, how difficult has it been to get funding?
To get what exactly?
How difficult has it been to get money for the organization to run its activities?
Okay. No, of course, it is a costly intervention. It takes a big budget, and MSF is an organization that calls upon its private funds, supported also with some governmental donors. But for me, the main problem for this epidemic has been to find enough specialized people that have the capacity to work in these specific difficult conditions. And that is really for us, together with, of course, to gather the funds for this intervention, the main bottleneck. As I said, it's the first time we are faced with such a large task, and for us it is really the first time also that we can't cover all the different sites with treatment centers. So we need more people and more organizations on board.
Okay, at this point, Dr. Ogunubi, the World Health Organization said drastic actions would be needed. Drastic actions, what exactly are drastic actions, and how do we, put them into place to get past this?
Well, if you listen to what he said, the issue is not about money. And that's why he didn't dwell much on the fact that money, because government, donor agencies are always willing to prevent things like this.
How do we curb?
But to be drastic, it is not for someone to say, I don't believe in this virus. Because if you don't believe in it, you are going to affect me. Therefore, there must be a law enacted.
All right, and I'll pause you there. Dr. Bart, so what are the prospects for the fight against Ebola?
It's a very good question. We haven't been able to predict this second phase, so it's difficult to make predictions where the epidemic will go. But from what I see now, I really believe it will take several more months to get the epidemic fully under control, unless we get really a big increase of capacity on the ground. Sierra Leone and Liberia are really also concerning now.
All right.
And in the epicenter of Forestral Guinea,
all right, thank you very much, Dr. Bart. Thank you very much. Sorry, we are running out of time. Now, your final words, as brief as possible.
Well, it's just for every country that this particular virus has not spread to wake up, enact laws, begin to do capacity building, train the people, let doctors, nurses, everybody, paramedics, let them get to know about this particular condition, and let there be rapid communication to the grassroots level for us to prevent this thing.
I wish we could end this on a brighter note and tell you that there's a cure, but unfortunately no, and we have to go. But remember, the discussion doesn't end here. Let's go back online and continue. So keep those tweets coming and those Facebook comments coming rather. Goodbye.